Greetings, everyone. This is Miss Gibson. This is lecture 2 for the immune system. This is an introduction to inflammation and immunity. Some definitions that you need to know. The first one is immunity. This is the process in which the body is protected from disease and maintains defense mechanisms. And then immunocompetent, this is a term used to describe an adult with fully functioning immune system and has maximum protection against infection. So some components of immunity would be intact skin, mucous membranes, white blood count, white blood cells, and then, of course, their products. Your immunity or your immune system will identify self versus non-self. Increased immunity leads to hypersensitivity and autoimmune disease. With immunocompetent, this is maximum protection against infection, like we said. All parts and functions are working. Maximum protection against infection. Decreased immunity can be temporary or permanently endangers one's health. This is in your Foundations book, chapter 55, that starts on page 1967. So we know what immunocompetence is. If the immune response is too weak or too vigorous, homeostasis is disruptive, causing a malfunction in the system. This is called immunoincompetence. With disruption of the homeostatic balance of the immune system, a number of diseases can develop. Examples of inappropriate immune responses can be classified into 4 categories: allergies, immunodeficiency, autoimmune disorders, and then attacks on beneficial foreign tissues. With allergies, allergies are caused by hyperactive responses against environmental agents. This can be medication allergies as well as allergies to allergens such as dust, mold, or pet dander. Immunodeficiency disorders includes acquired immunodeficiency syndrome or AIDS. Could also be therapy-induced immunodeficiency from treatments such as chemotherapeutic agents given for cancer, as well as immunosuppressant medications. In addition, some individuals are born with immune deficiency disorders in which the function or development of immune components is impaired. Autoimmune disorders include lupus, celiac disease, thyroid disease, inflammatory bowel disease, type 1 diabetes, multiple sclerosis, psoriasis, rheumatoid arthritis. Those are just some examples of autoimmune disorders. Attacks on beneficial foreign tissue include organ transplant rejection and transfusion reactions. So next we're going to talk about the functions of the immune system. You have defend and protect, remove and destroy, and then identify and destroy. Defend and protect, these are defense mechanisms to prevent re-entry back into the body. The number one defense is skin. The mucous membrane, natural chemicals prevent bacterial growth. Then remove and destroy damaged cells, identify and destroy malignant cells, thereby preventing their further development into tumors. An overview of the immune system: it's activated by minor or major injury. Response may be specific to response may be to a specific antigen or non-specific. When the inflammatory response is unable to destroy the invading organisms or toxins, the immune system is activated. And we know that immunity is the body's first, is the quality of being insusceptible. Excuse me, so sorry. Immunity is the quality of being unsusceptible to or unaffected by a particular disease or condition. Forgive me, I completely just word vomited that. My goodness. Immunity has two major subclassifications: innate or natural, and adaptive or acquired. Innate immunity is nonspecific, where adaptive immunity is specific. So those are things that you definitely need to know, and that is discussed in your book on page 1968. So self versus non-self. This is recognition of self versus non-self is recognition of this is referred to as self-tolerance. Non-self refers to infected body cells, cells from other people, cancer cells, invading or foreign organisms. The human leukocyte agent, or HLA, this is a universal product code. It is a protein that can be found. It identifies each person's different agents. It will identify antigens which are on a cell surface. It's capable of stimulating a response. It is present, the HLA is present on the surface of most body cells, not just leukocytes. It determines tissue type, which is coded by specific genes inherited from both parents. It's key to determine self-tolerance. Immune cells constantly encounter cells. If not a perfect match, cells take action to neutralize, destroy, or eliminate the invader. Then you have toll-like receptors, or TLRs. These are key elements for recognition of non-self. Purpose is to interact with the surface of invading organisms to identify as non-self. Also identifies damaged or unhealthy self cells. We know that immunity changes throughout adult life due to nutritional status, environmental conditions, drugs, diseases. As we age, there's always deficits there. Your immune system is most effective between the age of 20 to 30. Older adults have decreased immune function, which increases risk for many health problems. Organization of the immune system. Let me move my box here. So you have the bone marrow, which is a source of all blood cells, including most immune cells. Produces immature, undifferentiated cells called stem cells. The immune system is present throughout the body. Most comes from the bone marrow. Some mature here, others in different body sites. Once mature, these cells are released into the blood to circulate to most body parts and have specific effects. The bone marrow does produce immature differentiated cells or stem cells. Pluripotent just refers to each cell has more than one potential outcome. Erythropoietin, this is a growth factor for red blood cells. This causes growth. Erythropoietin exposure causes growth to mature as red blood cells. So you just need to know that the bone marrow, let's see, is a source of all blood cells, including most immune cells, and it produces immature stem cells. Leukocytes, this is your white blood cells. The function is to protect the body from the effects of invasion by organisms. They recognize self versus non-self, destruction of foreign invaders, cellular debris, unhealthy and abnormal cells. They produce antibodies against invaders. They complement activation and produce cytokines that stimulate formation of leukocytes in bone marrow and increased specific leukocyte activity. No competence, you have inflammation, antibody mediated, and cell mediated. Those are the three processes needed for immunity. So the first one is general immunity. The first stage that we'll discuss is inflammation. This is also known as innate, native immunity, or natural immunity. It's the first line of defense, which is the skin, mucous membranes, cilia, urine, gastric fluid, or the gastric acid, prostate fluid, tears, nasal secretions, saliva. When this is altered, inflammation results. Nonspecific immediate protection against effects of tissue injury and invading foreign proteins. So with inflammation, the inflammation doesn't transfer from one adult to another. It's immediate short-term response. It doesn't provide immunity with repeated exposure. Same response to injury or invasion regardless of location or cause. Starts with discomfort, helps to get rid of the harmful organism, helps start both antibody mediation as well as cell mediation action to activate the full immunity. Infection is usually accompanied by inflammation, but inflammation can occur without infection. Inflammation does not always mean an infection is present. Next, we're going to talk about cell types involved in inflammation. We have leukocytes, which consist of neutrophils, macrophages, eosinophils, and basophils. There's also tissue mast cells. Leukocytes are the primary cell in both specific and non-specific immune system responses. It comes from stem cells in the bone marrow. Then they're transfer self to site of inflammation or immune response. It can identify, attack, and destroy anything foreign. Your normal count is 4,500 to 10,000. Leukocytosis is an increase in white blood cells, anything above 10,000. This is seen when an infection causes an increased number of WBCs to be released from the bone marrow. Where leukopenia, this is a decreased number of white blood cells. It occurs when bone marrow activity is suppressed or leukocyte destruction increases. So your neutrophils are granulocytes. This makes up 55 to 70% of the total white blood count. Takes 12 to 14 days to mature. They only live 12 to 18 hours. They must be replaced constantly. Their function is to protect against invaders, which is phagocytosis and enzymatic digestion. Next, we have macrophages. This is released from the bone marrow as monocytes. They mature in tissue as microphages or microphages. I've heard them called both. The function is phagocytosis, repair, antigen presenting, processing, secretion of cytokines from the immune system control. Protect in immediate inflammatory response and stimulate a longer lasting response. They have a long lifespan. Each cell can take part in many phagocyte events. Basophils, only 1% of total white blood count. These cells are the cause of signs and symptoms of inflammation. The function is they act on blood vessels, both general inflammation and inflammation of allergic reactions. Eosinophils, this is active against infestations of parasitic larvae and limits inflammatory response. 1 to 2% of total WBCs. The numbers increase during allergic response. Then your tissue mast cells originate in the marrow and do not circulate as mature cells. Mature in tissues near blood vessels, nerves, lungs, skin, and mucous membranes. Maintain and prolong inflammatory and hypersensitivity reactions. Phagocytosis, this is where they engulf and destroy any invaders. There are 7 steps. Expose an invasion. The WBCs in blood and extracellular fluid start with the invader by identifying as a foreign body. Attraction, the WBCs come into direct contact and bind to the surface of the invading protein. Adherence, they bind the phagocyte cell to the target foreign body. recognize, they recognize as non-self or debris. Cellular ingestion, this is engulfment. Phagosome formation, enzymes attack ingested target cells. And then the degradation, I cannot say that word, please forgive me. Lord help me. Digest and engulf the target. I don't know why I'm having so many issues pronouncing words today. Next, we have the 5 cardinal signs of inflammation. Stage 1 response in the area. The stage 1 is vascular response. This is injured tissue. The leukocytes and tissue mast cells secrete histamines, serotonin, and kinines that constrict small vessels and dilate arterioles, which results in redness and warmth. There's also an increased blood flow to that area and an increase in nutrients to the injured sites. The capillaries leak blood plasma into the tissues, resulting in swelling and pain. The swelling is to cushion the area, to decrease additional injury. The duration depends on the injury level, but usually 24 to 74 hours. Macrophages are already present, resulting in rapid response. Limited number, but secrete cytokines. So there's a small amount of macrophages there, but they are secreting the cytokines. Then you have something called the colony stimulating factor, which triggers bone marrow to shorten production time from 14 days to hours. It's amazing at what our bodies can do. Other cytokines cause neutrophils to move from bone marrow to the site of injury, which leads to stage 2. Stage 2 is cellular exudate. This is where there's an increased number of neutrophils circulating. Exudate is formed, or pus, which contains dead WBCs. You have necrotic tissue and fluid that escapes from the damaged cells. Neutrophils, basophils, and tissue mast cells are active in this stage. Cytokines increase neutrophils within 12 hours after inflammation starts. They attack and destroy organisms and remove the dead tissue by phagocytosis. Basophils and tissue mast cells continue the initial response. If an acute inflammation in healthy adults, the body produces enough mature neutrophils to manage and prevent overgrowth of the organism. When lasting longer than a few days, the bone marrow releases immature neutrophils, limiting the inflammatory response, but increasing risk for sepsis. And then stage 2 is tissue repair and replacement. This is completed last, but is started at time of injury and critical to final function of inflamed area. It starts with replacement of lost tissue. WBCs induce healthy cells to divide. In tissues that cannot divide, new blood vessel growth is triggered and scar tissue formation occurs. Scar tissue is different from original tissue and function may be lost. Scar is a patch over the injury. Inflammation only cannot provide long-lasting immunity. Lymphocytes are needed for long-lasting antibody-mediated immunity and cell-mediated immunity. Specific immunity. You have antibody-mediated immunity and cell-mediated immunity. This is adaptive protection that results in long-term resistance to invaders. Response is not automatic, thus called acquired immunity. Cells develop specific response to specific organisms. Lymphocytes develop actions and products that provide specific immunity. So the first one is the antibody-mediated immunity, also known as humoral immunity. This uses antigen-antibody interaction to neutralize, eliminate, or destroy foreign proteins. In the antibody-mediated immunity, you have B lymphocytes that produce antibodies. The B cells become synthesized to specific foreign protein, aka antigen, and produce antibodies for that specific antigen. The antibody causes actions to neutralize, eliminate, or destroy the antigen. B cells have most direct role in antibody-mediated immunity. Macrophages and T lymphocytes, which will be discussed more next, work with these B cells to generate antigen-antibodies interactions. For optimal antibody-mediated immunity, the entire immune system must function adequately. B cells start as stem cells in bone marrow and then migrate to secondary source, which would be the spleen, lymph nodes, tonsils, or mucosa of the GI tract. Then next we have antigen-antibody interactions. In the antigen-antibody interaction, the body learns to make enough of any specific antigen to provide long-lasting immunity against specific organisms. So there's 7 steps to antigen-antibody interactions. The first one is invasion or exposure. This is where a large enough amount of invaders trigger non-specific defenses or overwhelm its ability to rid the invaders. Then you have antigen recognition. This is the recognition of the antigen as being foreign by the unsensitized B cells. Next, you have sensitization, which is B cell. The B cell becomes sensitized to the antigen. Then you have antibody production and release. Antibodies are produced by plasma cells. As many as 300 molecules per cell per second are produced. This gets released into the blood and body fluids as free antibodies that are separate from the B cells. Circulating antibodies can be transferred from one adult to another for immediate short-term immunity. Antibody-antigen binding is your 5th step. These are antibodies that are Y-shaped and can attach to 2 antigens or 1 and 2 separate sites. The stick of the Y attaches to the WBC's receptor site, increasing WBC's power to stick to the antigen. Antibodies may not be lethal, but other actions are also started. They neutralize, eliminate, or destroy the antigen. Sustained immunity provides a long-lasting true immunity to a specific antigen. It has a memory of that antigen. When re-exposed, enough antibodies are produced that illness does not occur. This results from memory B cells made during sensitization. Upon exposure to the same antigen, the memory cells respond by dividing in forming new blast cells and plasma cells. Next, this is acquiring antibody-mediated immunity. First, we're going to talk about adaptive immunity. This is where the body learns a response to invasive organisms or foreign protein. You have natural or artificial. With active immunity, the antigen enters the body. The body responds by making specific antibodies against the antigen. Active as body takes an active role in making the antibodies. For natural active immunity, you have an antigen that enters the body naturally without human assistance, often causes disease first, and it's most effective and the longest lasting. Artificial active immunity, this is your vaccinations and immunizations. This is used to prevent and protect against serious and potentially deadly illnesses such as tetanus, polio, and diphtheria. With passive immunity, this is a transfer when made by one human to another human, as the receiving human recognizes as non-self, they are eliminated quickly. Immediate short-term protection, the body doesn't make an antibody. So this would be tetanus, rabies, poisonous snake bites. You also have natural passive immunity. This is passed from mother to fetus, infant through placenta or colostrum in milk, in breast milk. Then you have artificial passive immunity. This is immunity to prevent death or disease when exposed. One example of artificial passive immunity would be the administration of the rabies immune globulin. This is after a person is bitten by a rabid animal. The rabies injection provides immediate antibodies against the rabies virus without the person's immune system needing to produce them. So that's just an example to help you guys understand what that artificial passive immunity might be. Next, we have cell-mediated immunity. This involves many WBCs. This is another type of adaptive or acquired true immunity provided by lymphocyte stem cells that mature in secondary lymph tissue or of the thymus and perichordal area of the lymph nodes. For total or full immunity, cell-mediated immunity must function optimally. So the cell types is you have your helper or inducer T cells. These act as organizers. They recognize non-self antigen and then secrete cytokines that enhance activity of other WBCs and increase overall immune function. The organizer of calling in the arms squad of WBCs involved in inflammatory and antibody cell production. Suppressor T cells act as regulators. They have opposite function of the helper cells. They prevent hypersensitivity when exposed to non-self or protein. It also prevents formation of antibodies directed to normal or healthy cells, which is the basis of many autoimmune diseases. The cytotoxin or cytolytic T cells destroy cells that contain human leukocyte antigens, the HLAs. This is most effective against parasites. Then we have natural killer cells. This is very important in the cell-mediated immunity. They seek and destroy non-self cells, most effective in destroying cancer cells or viral infected cells. So cytokines, we keep hearing about cytokines. What are they? They are a small protein hormones produced by many white blood cells and some other tissues. They are produced by cell-mediated immunity, regulating the immune system by production and activity of these cytokines. You have monokines, which is made by macrophages, neutrophils, eosinophils, and monocytes. You have lymphokines, which is made by the T cells. They do work like hormones. One cell produces a cytokine, which exerts its effect on other cells in the immune system. They act like messengers that tell specific cells how and when to respond. Cells that change their activity when a cytokine are present are responder cells. So cytokines include interleukins, interferons, colony stimulating factor, tumor necrosis factor, and transforming growth factor. This is a protection provided by cell-mediated immunity. It helps protect the body through the ability to differentiate self from non-self, watches for and rids the body of self cells that may potentially harm the body. It is important in preventing the development of cancer and metastasis after exposure to carcinogens. So that cell-mediated is a very important part of the immunity. Now let's talk about what happens with our immune system as we age. So as we age, we are at an increased risk of autoimmune as well as infection. The normal flora of skin, our GI tract, our mucous membrane all change. And we have a potential to have an overgrowth of more pathogens. We also experience a decreased number and function of neutrophils and macrophages. May have a fever even, may not have a fever even with severe infection. We have less recognition of pathogens, which increase the risk of sepsis. We have an increase in WBCs. The increase in WBCs may be delayed or absent. T cells may remain constant but less functioning. It does take longer to develop antibodies. Memory cells are slower, may need booster shots. Loss of recognition of self. With inflammation, you have decreased neutrophil function. The count might be normal, but there's a decreased activity which increases the risk for infection. Leukocytosis doesn't occur during acute infection. As we get older, infection present without change in your white blood count. Antibody-mediated immunity, there's a decreased number of colony-forming bead lymph and the ability to develop into antibody-secreting cells are decreased. Older adults can't develop new antibodies, thus they do need the vaccines for flu, pneumonia, shingles. Cell mediated, the number of circulating T cells decrease. Odor, let's see, there is an increased risk for bacterial, fungal infection, especially on the skin, mucous membranes, as well as your respiratory tract and your GU tract. All right, so now we have some practice questions. The type of immunity achieved through the administration of a vaccine is called what? Active immunity. Immune function is most efficient when people are which age? 20 to 30. Or they're called healthcare acquired infections now. They used to be called the nosocomial. And the definition is this is an infection that occurs 48 hours after hospital admission, within 3 days of discharge, or within 30 days of a surgical procedure. Causes, they can be caused by bacteria, viruses, fungi. Common culprit is C. diff. You know, with C. diff, it is prolonged use of an antibiotic. It cleans out the natural flora in our GI tract, and we end up with diarrhea. Could also be staphylococcus, which is your MRSA, Klebsiella, or Pseudomonas. The settings, HAIs can happen in hospitals, surgical centers, dialysis clinics, as well as long-term care clinics. This is the different types of infections. I'm sure you've heard of a lot of these, your CAUTIs or your catheter associated urinary tract infections. That's if the patient has a Foley catheter. Klebsiella, this is your central line associated bloodstream infection. Your SSIs, which is your surgical site infections. VAPS, which is your ventilator associated pneumonia. Then you have your C. diff as well as your MRSA. It tells you the percentage of those as well, just for your knowledge. At any given time, 1 in 31 hospital patients has a healthcare acquired infection, causes tens of thousands of deaths. The CDC estimates 99,000 deaths per year, and that all come from the CDC's website. Of course, your prevention, number 1 is hand hygiene, regular hand washing. Remove catheters and lines as soon as possible. Always use a sterile technique. Follow your antibiotic stewardship. Most of your hospitals will have a policy on that. And then vaccinations, especially with your flu and pneumonia, as well as COVID vaccines. Your community acquired infections, this is an infection acquired in everyday settings such as home, school, workplace, public spaces, rather than your healthcare facilities. If symptoms appear before hospitalization or 48 hours of admission, the infection is considered community acquired. This is different from healthcare acquired, which occurs during or after treatment in a hospital. Sorry. For some reason, my computer screen just went crazy. Common types, of course, you could have respiratory, which would be your pneumonia, influenza, RSV, COVID-19, your rhinovirus, which is just your common cold. Skin and soft tissue, Staph infection or your MRSA is a biggie. Ringworm. For your GI tract, the norovirus. Another big one would be the salmonella. We had an outbreak here a few years ago of that. Other viral and bacterial, strep throat, scarlet fever. Strep throat is seen a lot, especially in school age kiddos. Prevention, of course, the number one is hand hygiene, vaccines, avoid smoking, it protects the lungs, safe food practice, proper cooking and clean water supply, and public health matters. Measures such as isolation during outbreak, usage of masks. So we hear a lot about staph, MRSA, MRSA. It is a strain of staph lococcus, a NRS, that is resistant to methicillin, and related antibiotics. It is referred to as the superbug. 1 in 3 people carry staph bacteria on their skin or nose, but only 2% carry MRSA. Most of us that has been in healthcare for especially a prolonged period of time are probably carriers of staph. They can swab our nasal area and send that off to test it. Symptoms, if it's a skin infection, of course, you're going to have red, swollen, painful bumps that may look like pimples or spider bites. They're often filled with pus. Systematic infection, you're going to have fever, fatigue, cough, chest pain, shortness of air. If it spreads to the bloodstream, that can lead to sepsis. You could also end up with pneumonia or endocarditis as well. Risk factors, of course, you may possibly end up in the hospital. As you're in the hospital, some of these devices might be used that can cause a supra infection, like catheters, IV lines, ventilators. Another risk factor would be contact sports, crowded, unsanitary living conditions, such as your prisons, and as well as your patients that already have a weakened immune system are at an increased risk. Prevention is always hand hygiene, proper wound care, avoid sharing personal items, and then following hospital precautions as well as community precautions. Treatment of first, we're going to do some cultures from the wound, blood, urine, sputum, depending on their symptoms. The patient would be given an antibiotic even though it's resistant. You can still use Vanc, clindamycin, doxycycline, those are big ones, or the sulfa drugs as well are biggies to treat staph infections. They may have to have an IND done as far as surgical care. Most skin infections are treatable, but serious staph infections like bacteremia, if it gets in your blood, carry a 20 to 50% mortality rate. VRE, this is enterococci. It's a common bacteria in the gut and environment. When they become resistant to Vanc, they are called VRE. Vancomycin is often the last line antibiotic for enterococcal infection, so resistance makes treatment more difficult. In 2017, VRE caused an estimated 55,000 infections among hospitalized patients and about 5,400 deaths in the United States, and that's according to the CDC website. Common sites of VRE infection: urinary tract, bloodstream, which could lead to bacteremia, wounds, and intestines. And then treatment for this is going to be combination therapy. It really depends on what your lab and your testing shows. Is it a colonization versus infection? Some people carry VRE without symptoms. If it's a colonization, that does not require antibiotic. And then isolation, of course. VRE patients may be placed in private hospital rooms to prevent the spread of VRE. I'm sure that you've heard about the VRE and the MRSA if you've worked in a hospital setting at all. The VRE stands for vancomycin resistant enterococci. So, and that is it for your intro to the immune system. If you have any questions, please send me a quick email and we can figure out the answer together. Thank you.